What I wanted to brain dump about today, I do want to talk about the topic of a major news report by AOL News, October 13th, 2025, a fatal fall. Louisiana CNA charged after operating a lift by herself kills patient. And I'm not here for anyone to listen to me. I'm not here to try to control anyone. I'm not here to manipulate anyone. I love to do videos. I love to share from my personal experiences, and I love to brain dump. And from my perspective on certain situations and things of that nature. And one of the places I have been most of my life, I do know quite a bit about, is the workplace environment. And so, with that being said, I am going to talk about this fatal fall a little bit from my perspective, as well as what has been documented and sent out by the news media. So the CNA was charged after operating a lift by herself, you know, like the ceiling lifts, and you put the patient up and the patient slipped through and fell out. So her name is Diamond Johnson, a certified nursing assistant at Jefferson Manor Nursing and Rehab Center in Louisiana. Was indicted by a grand jury on October 2nd, 2005, for negligent homicide after a patient died following a Hoyer lift fall in June of 2024. The indictment claims she operated the lift alone against facility policy, which requires 2 staff members at all times. I added that at all times myself. Yahoo News, October 2025, reports confirmed Johnson's negligent homicide charged by a Baton Rouge grand jury tied to a fatal hydraulic lift incident involving an elderly resident. Tampa Free Press, October 13, 2025, another verified report confirming the same details, adding that the Attorney General's office described the event as a failure in duty of care to a vulnerable patient. Video coverage. There are several video commentaries and news discussions have analyzed the case. YouTube video, nursing assistant charged with homicide for a patient falling from Hoyer lift, posted October 6, 2025, explains that the patient fell from the sling, hitting her head, and later died. The CNA was already booked into the East Baton Rouge Parish Prison. There's an Instagram reel. The nurse, Erica, covered the story under CNA Hoyer lift incident. Understanding implications for nursing, generating national debate among healthcare workers. YouTube discussion. The nurse Erica, October 8, 2025. CNA is criminally charged. Is not new. God damn. Contextualizes this case among a pattern of recent legal actions against care staff for workplace incidents. So, like I said, I wanted to brain dump on this subject matter. And I'm thinking about I'm thinking about something from experience. And so what I think about is that, for example, me, I remember something happened. We had to rotate, and we helped out because all their CNAs called off, so they asked for the health techs to come in and help out. And knowing the policy as far as lifts, and there you go. Nurses like, no, I'm too busy. I'm passing meds. I'm blah, blah, blah. But see, everybody don't have, I'm going to call it a big mouth like I do. right? When it comes to policies and procedures and people disrespecting and devaluing you and this and that or whatever and not doing what's right. And so as we learn that everybody's different, everybody responds to things differently, everybody cannot speak up. Young people, it depends on the personality, you know, and how to learn how not to curse somebody out when you know they're wrong, or how to not do the job they demand you to do when you know it's wrong, right? You know, without getting help. There's a whole lot involved in that. But the main thing I wanted to point out is that, so if you've been doing things in the justice system for a while and getting away with it, you know, that's the justice system, right? You know, you document against for example, in this case, the nurse and assistant, and let them, you know, be buried. And yes, what they did was wrong. And that's another thing, like I said, a lot of situations can come up out of that, is always think, if you know a patient going forward, you always watch their bodies and this and that. What I would do, I would hurry up and place my body under their body, or my legs under their body, or something under their head, to make sure that on my watch, while I'm with them, that head is not going to hit that ground. You know, I have to get on the floor, I have to put my legs under them or whatever. You know, that's something to think about as well, you know. But the big issue that I'm brain dumping here is that, I understand. So if the nurse is in the nursing home and she has 15 to 30 patients, she's too busy. She can't do it. All the other nursing assistants called out, you got to do it, you know, or nothing's going to happen to you. You can do it. Or, you know, I got you. You can do it, right? And, or anything. There's so many different things can happen. So many different, like, personalities in this can happen. It could be a vindictive type personality. It could be a evil, wicked, nasty personality. It could be someone that's not aware personality or whatever. But with the justice system, not one person has said, as far as what I've looked up, like, so you are licensed personnel. Well, nursing assistant is licensed as well, but they're licensed as assistant. But a licensed registered nurse, or even some, I think in some nursing homes or rehab facilities, they have LVNs or LPNs, you know. And so you're not training the person right, you're not following rules, they fall under you as the senior person to train these young people, to train people, whether they've been on a job long enough or not, whether you like their position or treat them as, you know, just professional ass wipers or whatever. When the policy states 2 people and you just brush it off, you're not held accountable? Oh, but you had 15 to 30 patients on a nursing assistant ward, a rehab ward, and there's no way you could do it. So is there a bigger issue where the facility collecting so much money from here and there and here and there, but they don't have the staff and they couldn't call in temporary workers to help the staff, the permanent staff that's there? Should that facility be shut down? Should that nurse go to jail with more time than the CNA as someone who is qualified as a registered nurse or a licensed vocational nurse, practitioner nurse?
Right detail. Training speech about in healthcare. No one should hate to ask for help. It should be if you are not busy, get up and help your fellow man or woman out. And if you have that superior type mentality, where that's not my job, well, we know. And are really learning about various different personalities, behaviors, perspectives, which is not about color, religion, political party in the workplace. And if you don't know how to tell and have a decent conversation with nursing assistants to not make believe you are nurses when someone asks you, let them know their jobs are just as important, but they do not distribute medicine or lesson plans. How not to punish them because you refer to them as professional butt cleaners. And you know as licensed personnel what's illegal or not. And you should go to jail as well as the nursing assistant that put the patient in a Hoyer lift and the patient fell through, hit their head and died. So when you gave the nursing assistant instructions to get the patient out of bed, then when the nursing assistant comes to you and says, the policy states there needs to be 2 people at all times before putting the patient in a lift, you, the nurse, says my job is too important to pass meds and I can't help. Yes, you should be held accountable also and get more time in jail than the young assistant for setting her up and not teaching since you have so much education.
Yeah. The speech emphasizes teamwork, accountability, and respect in healthcare training. It's designed for staff development sessions or orientation programs. Speech. No one should hate to ask for help. In healthcare, no one should ever hate to ask for help. The moment someone hesitates to ask for help, patient safety begins to break down. Our work is not a solo act. It's a shared responsibility. Whether you're a registered nurse, a nursing assistant, a tech, or part of environmental services, we all serve one purpose: preserving human dignity and providing safe, compassionate care. Helping each other should not depend on your title. It should be part of who you are as a healthcare worker. If you're not busy, get up and help your fellow man or woman. Don't wait to be asked. Don't say that's not my job. In healthcare, everything related to a patient's safety is your job, especially when lives are at stake. That superior mentality where someone believes they're above assisting others does not belong in this field. We are learning more every day about human behavior, personality differences, and perspectives. And this has nothing to do with color, religion, or political party. It's about integrity in the workplace. It's about humanity. If you're a nurse who doesn't know how to have a decent, respectful conversation with nursing assistants, it's time to learn. Stop pretending the titles determine worth. When someone asks whether you're a nurse or a nursing assistant, be honest and respectful in how you answer. Don't dismiss the value of what nursing assistants bring. Their work is vital. Without them, patient care collapses. But also, recognize that their scope is different. They do not administer medication or create care plans. And And that's not a knock against them. That's structure, policy, and safety. We must stop demeaning people who provide essential physical care. Calling a CNA a professional butt cleaner is not funny. It's harmful, unprofessional, and dehumanizing. Every healthcare role deserves respect. The person cleaning a patient, repositioning them, or changing sheets is preventing bed sores, infections, and declines in dignity. And licensed staff, you know the law, you know the policies. If a nursing assistant tells you that 2 people are required to use a lift, and you tell them to do it anyway because you're too busy passing meds, you are at fault. You have now participated in unsafe practice.
In healthcare, asking for help should never be a source of shame or fear. It's a sign of strength and teamwork. Helping each other isn't determined by your job title. It's a shared commitment to keeping patients safe and respecting every member of our team. If you see someone struggling, don't stand by. Step up and help, saying, "That's not my job." Puts patients and colleagues at risk, especially in critical moments. We must recognize and respect different personalities and perspectives in our workplace. And remember, this has nothing to do with background, beliefs, or politics. It's about caring for people. Let's stop using harmful labels and dismissive language. Every role from licensed nurses to nursing assistants is crucial. Nursing assistants aren't just cleaners. Their work is essential for patient dignity and safety. Even if their scope is different from nurses, they do not give medicine and set care plans. But without them, our care falls apart. Licensed staff must model integrity and accountability. If a policy requires 2 people to use a lift, never pressure anyone to risk safety for speed. If something goes wrong, both parties are accountable, and it's the nurse's duty to protect and teach, not to delegate blame. Great care relies on mutual respect, honest communication, and answering every call for help. Respect each role, share responsibility. And remember, in healthcare, helping one another isn't optional. It's essential.